is a doctor has an asthma patient. He comes in and the guy has really bad asthma. His lungs just freeze up. He can't breathe. And the doctor has a new asthma drug, and he gives him the new drug. And the guy's breathing is just great. And he goes home. Several days later, he comes back and he goes, you know, that drug really worked really well, but now it's worn off. I need some more. And the doctor thought, well, I'm going to fool this guy. I'm going to give him placebo and see if this works. So he gave him a placebo. The guy took it, and the guy went home, and an hour later comes back and he goes, I don't know what was wrong with that, but it's not working. I can't breathe. And the doctor thought, well, interesting. The drug must really work because the placebo didn't. Well, then the drug company wrote the doctor and said, oh, we've done something awful. We sent you all placebos. So the guy got a placebo the first time as well, but the difference was that the doctor didn't know it. Not just the man, but the doctor didn't know it. So something implicit in the doctor's attitude or conveyed to this man, this placebo will work, this one won't. So, again, Lord only knows what we're learning just in the attitude of the people around us, and you've got to always, as I say, be vigilant over your own self and your own body. And there have been studies that have shown, for example, that drugs work better. You can take the same drug and put it in a different color capsule. First, if you give a drug in a pill or a capsule, the capsule will always work better than the pill, because we have a sort of cultural conditioning that capsules contain more potent drugs than just pills or tablets. You give it the same drug in an injection, it works even better, because we have a cultural conditioning that only really heavy drugs go in injections. And even the color of the capsule or the pill will affect the activity of the drug. So, you take the drug, and if it's a red pill, it'll work much better than if it's a pale yellow pill. And so all this stuff that we're completely unaware of, that we're constantly doing to ourselves, even more extraordinary, I mentioned, multiple people with multiple personalities. Multiples, it's been discovered that if you are performing surgery on a multiple, this multiple is under anesthesia, and another one of their personalities comes through while they're under anesthesia, they'll wake up on the operating table, and they won't be anesthetized. So therapists have to go in and say, okay, this personality has to stay under while the surgery is performed. And there are even instances of multiples, this is even more common, where multiple can get drunk. One personality can get drunk, and the other can drive home because the other's not drunk. And different drugs, like if a multiple switches personalities while they're on one drug, it's not affecting the other personality. Now, as I say, what does this mean? How can we, again, as I always keep in mind, as I say, the exquisite sensitivity of the self. And what do we do? What are we doing with, like, the nutritional information? I mean, every day, don't you hear about something else that's bad for you? This is bad for you, that's bad for you. And so what do you do when you eat? You think, God, I shouldn't be eating this because this is bad for me. And now, knowing all this, what on earth are we doing to our bodies with all this terrible stuff, that we're feeding our minds as well as our bodies? And there, again, you look at the medical literature, and there are things, we're all taught, there are things that challenge us, just extraordinary challenges to this. We're all taught, you don't eat a lot of eggs because that's going to raise your cholesterol, right? Well, it just came out in the literature, there's a fellow, he has an eating disorder, a psychopathology. He's got it through his head that he has to eat eggs to live. And so for the last 15 years, he's eaten 25 soft-boiled eggs a day. That's almost 140,000 eggs over the course of the past 15 years. Well, the doctors, when they learned about this, they thought, well, this poor soul, he's going to be, his arteries are going to be absolutely clogged. And they tested him. He has a lower than normal cholesterol. And I said, well, do you know your cholesterol is lower than normal? And he goes, well, yeah, what's cholesterol? And they go, well, why do you eat these eggs? Well, I have to eat these eggs to live. These eggs are good for me. I have to eat eggs to live because he's a nut, But he avoided having all this cholesterol. And lo and behold, other cases like this are surfacing. There's a man, I just read another case about a man who eats mainly bacon fat. No cholesterol level. Now, what would happen to us if we ate nothing but bacon fat? Our cholesterol would go through the ceiling because we know that that bacon fat raises the cholesterol level. Well, I don't believe that. I don't think it's better to be ignorant. I think it's better that we're in the middle ground between ignorance and enlightenment. Like the Neoplatonist Plotinus said, man is poised halfway between the beast and the gods, and that's where we are. We're right there. I don't think it's better to be ignorant. It's far better to be beyond. And so what do you do when you eat food? There's another case about a woman who ate a very high-fat diet, lots of junk food, but she was a follower of Edgar Cayce. I'm sure most of you probably know the name Edgar Cayce. And one thing Edgar Cayce said is he said, always bless the food before you eat it. And so she always does. She goes, this food will only make me healthy, and she always blesses it. And she she too has a normal cholesterol, normal triglyceride, normal cholesterol level, all this thing. But what do most of us do when we eat? Most of us curse our food constantly. You eat a candy bar, you go, well, this is going to mess me up, really. I shouldn't be eating this donut. Now, I'm not advocating throw nutrition out the window. I'm just saying, make nutritional choices. But if you're going to make the choice to eat something, for God's sakes, don't tell your body it's bad for you. Tell your body that it's only going to, it's blessed and it's only going to be good for you. Of course, Siegel has said the same thing about chemotherapy. He has people draw a picture of them receiving radiation or chemotherapy. Those that draw it as these death rays hitting them, he knows they're going to die. Those who draw it as sort of golden light bathing them, he knows they're going to live. Because what are they telling the exquisitely sensitive self, the infinite self that is taking all this stuff in? It's what you tell yourself that affects what's going on. And so if you're going to eat something, what I do is I try to eat a healthy diet, but if I feel like eating a donut, I eat it. But I certainly don't say, oh, well, now I'm really good, now I'm doing it to myself. I bless it. And, Siegel and other doctors of the Silk have stories of people who have their chemotherapy that instead of, even referring to it, like one woman took her chemotherapy and she wrote on a healing elixir. Because she decided, even the word, just as the colors of the pills affect us, well, this woman had decided, even the word chemotherapy has this negative valence, that if you're saying chemotherapy, we all know chemotherapy is deadly, And there's an experiment I talk about in the book where they took a group of cancer patients in England, they divided them in half, they gave half chemotherapy, half a placebo, told everyone this is a really toxic drug, may cause you to lose your hair, and 30% of the people taking the placebo lost their hair. What are we doing when we say these things to people? And we know these things, but we don't incorporate them in our common wisdom. Your doctor doesn't say, oh, by the way, this drug may cause you to lose your hair, especially if you believe it does. He or she just says, this may cause you to lose your hair. Some, slightly more enlightened, don't tell you. They say, well, I'm not going to read you the bad side effects, but that's even more scary, But the real attitude is, well, studies show that this causes this percentage of people lose their hair, but probably you wouldn't lose your hair if you believed you won't, And in fact, there's one woman who went to Siegel, and he gave her this really toxic chemotherapy, and she was absolutely fine on it. No vomiting, no hair loss, no nothing. And he said, you're doing really well on this. And she said, well, my friend told me that it would have no side effects. And her friend was a nurse and knew what she was doing. Said, you'll be fine. You'll be absolutely fine. The woman bought it. And so that's, I think, it's in a way that's still ignorance, but if you can go beyond that and become a little more conscious of it, I think it's even better. So the key word is always be vigilant. What are you telling yourself? Look at all the aspects of your life. Whether you're looking in the mirror, what do you tell yourself? When you look at your body, what do you tell yourself? When you eat, what do you tell yourself? When you go to a doctor, what do you tell yourself? What are you giving? What are the directions you're giving your infinite self? When you set goals for your life, what are you telling yourself? Well, I could never do that. Or are you telling yourself, well, I can accomplish anything I want? Just always, as I say, remember those words. Be vigilant, and then remember. The other thing that I think is crucial is remember that fear. Your unconscious mind always takes fear as a direction. So be careful about fearing, and be careful. Make a judgment. And we don't. It's kind of sad because I always liken human beings. We're like infants sitting at the control panel of jumbo jets because we have all these amazing capabilities and things, but we're just flicking switches out of ignorance. We don't know how to work, and we're not taught. We're taught. Our culture strives very hard to teach us what to think, but not how to think. And it's far more important to teach how to think than what to think. And so another thing that I always tell people, and it's very important, is if you start to believe something, it doesn't matter what the external reality says. If the external, as I said, if your evidence of your behavior suggests you have a bad memory, for God's sakes, don't then reinforce it by telling yourself you have a bad memory. And if you're doing something, ask the question, what is the payoff? What will I get if I tell myself this? Like I have a friend who his lover died of AIDS, and he had really been very attentive in the last several months of the fellow's life. Had taken him, out of the hospital, let him die at home. And after he died, and I went and visited this friend, and he was very upset, and not only just through the normal grief process, but he said, I just can't shake the feeling that I could have done something more. And I said, well, is there something that you think, a specific thing you think I should have done this and I didn't do it? He said, no, it just seems like I should have done something more. Well, I said, well, what's the payoff to thinking that thought? The payoff to thinking that you could have done something more. It's not that he had a logical reason for thinking that. He was just thinking, I could have done something more. And what was the payoff in that instance? It was pain. You know, so why run that sentence through your head? Because again, what I just said is we were all taught what to think, but not how to think. And we're not taught that whenever we run a sentence through our head,